So now I will talk about the management of cholelithiasis. In the management, first of all, there will be nutritional support therapy, and then the pharmacological therapy, and then there is a surgical removal and surgical management, and non-surgical removal and surgical management, and nursing management. Now I will talk about what's the food therapy. So we advise the patient about the avoid fatty meal, because fatty meal will cause more pain. Why? Because it stimulates vagus nerve, and as a result gallbladder contract and patient feel pain. So symptom mostly develop due to when patient is taking high fatty diet. Then there is a pharmacological treatment. In pharmacological treatment, we give the patient that drug we call also deoxycholic acid. That drug actually doing what? They inhibit the synthesis and secretion of cholesterol. So if there is a stone, so they reduce the size, or there is a small one stone, so it can dissolve. And they also prevent new stone formation. Then we also do non-surgical removal. That procedure, many of you may be familiar, we can do in the kidney stone. And in that procedure, what happens? Some wave pass through the abdominal wall, and they break down the gallstone, and then they excrete from the body. Then we will do what? Laparoscopic cholecystectomy. If the common bile duct is obstructed, then we will not do laparoscopic. Then we will do ERCP. But if there is no stone in the CBD, only in the gallbladder, then we will do what? Laparoscopic cholecystectomy. And then this is about the laparoscopic. See, this is a laparoscopic, this is surgical tools, and this is how the surgeon perform the cholecystectomy. And this is an open in which we do incision just to take out the gallbladder. This is a laparoscopic, that how we perform the surgery. And see, this is a surgeons how they perform the surgery. This is a just screen in which they will visualize actually what's going on inside the abdomen. They will see the gallbladder, liver, all the structures around the liver, and this is how the surgeon performing laparoscopic cholecystectomy. And this is a choledochostomy, in which when stone in the CBD, so incision is made into the common duct, usually for the removal of stone from the common bile duct. And this is about the percutaneous cholecystostomy procedure. That procedure we do in case of is there any inflammation. Why? Because when the stone obstruct the gallbladder, if stone obstruct in the common bile duct, so we will do what? In the cystic duct, so we will do what? That procedure. Actually that procedure decrease the pressure inside the gallbladder. Now talk about the complication. The complication will be most commonly acute cholecystitis, choledocholithiasis, pancreatitis, gallstone ileus. So gallstone ileus is what? Actually gallstone ileus, when gallbladder becomes so much stress, so much stretch, ischemic, maybe it can perforate, and it can make a fistula, or it can make a connection between the gallbladder and GIT tract. When there is a connection between the gallbladder and GIT tract, and the stone pass, and they travel into where can be in the ileus region, ileum, and they do what? They block the ileum part. So gallstone ileus means gallstone ileus is a complication of what? Gallstone. And when acute cholecystitis will be happen, and perforation of gallbladder and gallbladder carcinoma. Then a patient education, how we sitting patient are advised, this is a post of education. We advise the patient walk, daily walk, and analgesic medicine. And if you have any pain which is unrelieved even with analgesic use, then consult your surgeon. Then little exercise and drive a car can be after 1 week. And most importantly, check the wound every day, which is very important, just to avoid an infection. And resuming normal diet, and intake of fatty meal can be after 1 week after surgery can be started. And follow-up care, so if patient feel any pain, any fever, any nausea, any vomiting, so they can consult with their corresponding surgeon. So this is a follow-up care. Now in the summary, I already talk about anatomy, definition, incidence, and the pathophysiology, diagnostic test, and management. So that's all about the cholelithiasis. So if you have any question about that, so you can ask me in the comment section. Thank you.